Pharmapal.
Discovery and development of Manamilus for the treatment of plaque psoriasis. A drug, Manamilus, FK6013, has been developed to target moderate to severe cases of plaque psoriasis with minimal side effects. It works by inhibiting T lymphocyte signal transduction to reduce inflammation. Animal models and toxicity testing have been conducted. This paper outlines the preclinical data, phase trials, and NDA statement for Manamilus, FK6013, a drug for the treatment of plaque psoriasis. It also provides information on psoriasis as a chronic inflammatory disease. Psoriasis affects all age groups, and the prevalence of psoriasis in both sexes has been increasing in recent years. Stressful life situations, genetics, and immunology are the suspected causes, and psoriasis can be classified by age of onset, disease severity, and morphology. Potential psoriatic genes and immunology cascade. Psoriasis is associated with specific genes and immunological processes that cause T-cell activation and cytokine release, leading to chronic inflammation and psoriatic lesions. The activation of dendritic cells and T cells and their migration to the epidermis causes hyperproliferation of keratinocytes and vascular cells, which triggers psoriasis. The immune response and diagnosis of psoriasis. T cells become CLA plus memory cells that are type 1 or type 2 effectors. Psoriasis severity varies, with plaque psoriasis being the most common. Diagnosis is based on skin appearance, with no special tests needed. Management is based on evaluating the severity of psoriatic lesions. Treatment options for plaque psoriasis. Psoriasis can worsen over time, and treatments aim to control symptoms. Topical therapies, phototherapy, and biologics are options based on disease severity. Combination therapy may increase compliance. Comparative analysis of medications for psoriasis treatment. Various treatment options, including topical, systemic, and biologic agents, are available for patients with psoriasis. Topical treatments involve vitamin D analogs, corticosteroids, and TAR, while systemic therapies include immunosuppressive drugs and biologic agents with different mechanisms of action. However, undertreatment and treatment dissatisfaction remain problematic for psoriasis patients in the U.S. Treatments for plaque psoriasis. This context provides information on various medications used to treat plaque psoriasis, including their mechanism of action, efficiency, side effects, dosage, and annual sales. These treatments include topical tazarotene, soriatane, systemic tacrolimus, oral retinoids, and biologics like Humira, Enbrel, Stelara, and Remicade. Efficiency, side effects, and medical needs statement for treatment of plaque psoriasis. A recommended dose for plaque psoriasis treatment shows 49 to 80% improvement after 10 to 12 weeks with side effects such as infection, rash, and stomachache. More effective and safer treatment is necessary. Calcineurin and NF-1 signaling in plaque psoriasis treatment. Calcineurin activates NF-1, which increases IL-2 gene activity, leading to immune responses and psoriasis patches. Drugs like cyclosporin A and topical tacrolimus inhibit T lymphocyte and IL-2 activation by blocking calcineurin. Discovery and development of Manamilus for treating plaque psoriasis. Development of an oral calcineurin inhibitor for treating plaques located under challenging areas of moderate to severe plaque psoriasis, using the mechanism of action of FK506, tacrolimus, in T cells. Assays for binding of tacrolimus and lead component to receptor FKBP12 will be conducted using direct optical detection and competitive radioimmunoassay methods. A step-by-step procedure is provided. Direct detection of protein-ligand interactions. A regeneration procedure using mild basic solution or detergents can remove unspecific binding on serum protein surfaces. A better SPR signal can be obtained by attaching lead to an nanoparticle for signal amplification. Competitive radioimmunoassay can measure lead's binding capacity to compare with literature drugs. Competitive radioimmunoassay for direct binding of drug receptor. A step-by-step procedure for measuring drug receptor binding affinity is demonstrated. The lead can be optimized by replacing functional groups and substitutions, as shown in tables 2 and 3. Development and testing of drug compounds. The hydrophobic and hydrophilic properties of new drug compounds are analyzed to ensure they bind with target proteins and cross barriers. In vitro testing is done to evaluate efficacy, toxicity, and non-interference with metabolic enzymes, CYP450. In vitro hERG inhibition assay and adenosine kinase, AK, inhibition assay for heart and immune system safety assessment of lead compound. Electrophysiological studies are critical in drug development to ensure drugs do not cause cardiac arrhythmia. An in vitro patch clamp assay was conducted to measure the potential QT prolonging ability of a lead compound by examining its effects on hERG ion channels. Another assay was also performed to test whether the lead could inhibit adenosine kinase, AK, activity related to T lymphocyte activation. FK506 inhibits adenosine uptake and AK activity, leading to an increase in extracellular adenosine. Examining the binding sites of AK inhibitors predicts the AK inhibition activity of a lead molecule. The X-ray crystal structure of peptide inhibitors bound to the catalytic subunit of cyclic AMP-dependent protein kinase is shown. Pharmacological profiling of NCEs for psoriasis treatment. Testing of new chemical entities for psoriasis treatment reveals a hydrophobic NCE5 that will cross the intestinal barrier and target cells effectively. CYP3A4-mediated metabolism inhibition by binding to FKBP12 allows my lead to avoid CYP450 inhibiting effects, while my lead does not meet the criteria for hERG channel blockers. Drug toxicity and pharmacological profiling. The lead molecule structure does not fit into the hERG pocket and AK does not accommodate the new chemical entity, NCE. NCE6 has good pharmacological profiling and is most potent for further development. On-target and off-target toxicity mechanisms are discussed. On-target and off-target toxicity. Excess FKBP12 inhibition by tacrolimus can activate TGFSS receptors leading to arterial hyalinosis. FKBP family proteins play critical roles in T-cell activation and can cause various disorders when impaired. The hydrophobic amino acids forming the base of PPIS domains in human FKBPs are labeled in a schematic. Tacrolimus, used to treat psoriasis, has concerns over long-term toxicities. No binding is predicted between FKBP65 and a new potential drug. Related functions of FKBP12 and calcineurin and potential side effects of tacrolimus treatment. Colocalization of FKBP12 and calcineurin in the brain suggests related functions. Calcineurin inhibition by tacrolimus can cause hypoperfusion, ischemia, and local secondary toxicity in white matter. Tacrolimus neurotoxicity symptoms can be reversed, but some patients experience permanent damage. FKBP12 binding activates endothelial TGFSS receptors leading to nephrotoxicity and arteriolar hyalinosis. IL-8 positive neutrophils can be used as an efficacy biomarker for plaque psoriasis treatment monitoring. Animal models for plaque psoriasis. Transgenic mice overexpressing certain cytokines or integrins are used to study the pathogenesis of psoriasis, but no perfect animal model exists. Xenotransplantation models using human skin grafted onto immunodeficient mice are also useful in drug development. Method for studying antipsoriatic compounds in animal models. Researchers use human keratome biopsies to graft onto mice to study the effect of different doses of antipsoriatic compounds on biomarkers and clinical response. Endpoints are observed to measure treatment efficacy. Dosages are calculated based on receptor concentration and potential side effects. Determination of optimum dosage concentration for treatment of plaque psoriasis. The optimum dosage concentration of 0.002 mg per kilogram was found to be effective in reducing psoriatic lesions in animal models. Higher doses have side effects like severe infections due to immune system suppression. Toxicology studies identified NOAEL values of 0.10 mg per kilogram for mice and 0.45 mg per kilogram for dogs. Animal studies and calculations indicate that the human equivalent dose, HED, for Manamilus is 0.25 milligrams per kilogram.
Pharmatel.